Bismillahirrahmanirrahim. So the last topic in glomerulonephritis is chronic glomerulonephritis. So chronic glomerulonephritis is end-stage glomerular disease which is characterized by the obliteration of the glomeruli. So there may be a history of acute glomerulonephritis, or in some cases there is no apparent history of acute glomerular disease. So the causes of chronic glomerulonephritis include membranoproliferative glomerulonephritis, then there is focal segmental glomerulonephritis, membranous nephropathy, IgA nephropathy, and post-streptococcal glomerulonephritis, which occasionally progresses to end-stage renal disease. In certain cases, there is no identifiable cause of chronic glomerulonephritis. Kidneys in the chronic glomerulonephritis appear to be shrunken because of the loss of glomeruli. There is increased perirenal fat, which is the fat around the kidneys, and the cortical surface appears to be granular. The cross section reveals thin cortex, which is again due to the shrunken glomeruli, and there is increased fat deposition. Histological appearance sometimes reveals the remnants of primary disease if there is a history of acute glomerulonephritis. In the late stage, there is obliteration of the glomeruli, which are replaced by the collagen. As you can see here, this is a glomerulus which is completely obliterated and there is collagen deposition. Moreover, there is increased mesangium. Like you can see here, the mesangial size is increased due to shrinking of glomeruli. Glomerular basement membrane also becomes thickened due to deposition of glomerular basement component. Moreover, there is arterial sclerosis, which results in hypertension. The atrophy of the associated renal tubules is also present, and there is interstitial fibrosis. Mononuclear infiltrate is also present sometimes. What is mononuclear infiltrate? The mononuclear cells include lymphocytes, such as T lymphocytes, monocytes, and natural killer cells or NK cells. Chronic glomerulonephritis presents with the non-specific symptoms such as loss of appetite, weakness and lethargy, nausea and vomiting, and often fever is also present. Edema and hypertension are classical signs which are present in chronic glomerulonephritis patients. Proteinuria is present at the early stage, and as the disease progresses, proteinuria decreases, which is due to obliteration of glomeruli. Moreover, there is azotemia and uremia. The blood urea nitrogen is greater than 20 mg per deciliter, and the patient requires dialysis. Renal transplant is also indicated in the end-stage renal disease. Coming on towards complications of uremia. The normal level of blood urea nitrogen in blood is 5 to 20 mg per deciliter or 1.8 to 7.1 millimole per liter. So the complications include uremic pericarditis. Pericardium is the layer around the heart which gets inflamed, hence pericarditis. Uremic gastroenteritis, uremic pneumonitis, which also causes pleural effusion, and uremic encephalopathy, which is characterized by drowsiness and decreased cognitive functions. So that brings us to the end of discussion about glomerulonephritis. If you have any questions, do let us know in the comment section. Thank you.